talking to people, getting a hang of things and making yourself visible helps in the eventual getting of a fellowship. And you generally need 3 referees, and if one of them is happy to pick up the phone on your behalf and speak to the fellowship supervisors, then I think there can be no better recommendation than that, because there are hundreds and thousands of applications which come in after every fellowship advert. But if somebody is able to stick out their neck for you and put their reputation on the line by calling the fellowship supervisor, then I think that holds more weightage than anything else. And sometimes luck. I mean, you have to be at the right place at the right time, but then you have to be prepared. You have got to have a CV which is ready, and sometimes opportunities come when you least expect them. So work profile of a fellow is pretty much similar to that of a registrar. You have more operating sessions and more independence in terms of operating. So after maybe 2 or 3 months, once your consultant is comfortable letting you do cases independently, you may start doing independent cases with a scrub practitioner or with a registrar. There is time allocated for research. Salary structure is pretty much the same. You're generally expected to complete 1 or 2 research projects. Again, it's not mandatory, but it always helps boost your profile. And there is no exit exam as such, because these fellowships are essentially jobs in university hospitals or places of excellence where you learn on the job. So there is no exit exam. So what to do after your fellowship? Well, in the UK, you have multiple options. There's always an option of coming back to India if that is something you've decided before going there, or for some reasons you decide to not continue your journey there. There's always an option of coming back to India. UK training is regarded quite highly in India by corporate hospitals as well as patients. You can decide to stay back in the UK. You can continue working in the NHS. Even if you are not a part of the training system, there are ways to become a consultant there, and they're not very difficult. So with time and perseverance, you can become a consultant in the UK. It takes about 5 years to get a permanent residency, and then another year to become a UK resident. So if migration is one of the things you want to consider, UK is definitely a very reliable and straightforward option. Things happen with time, with less uncertainty. And then once you're trained in the UK, a lot of opportunities in Australia, Canada, and Middle East also open up. The CCT or CSR, the training in the UK is directly recognized in most of the countries. So a lot of opportunities open up in these countries as well. So in conclusion, as far as the training in UK is concerned, it is a slow but sure way of subspecializing. You may have to start at the bottom, but then it is a transient phase. It helps you to understand the system, and it helps you to understand what they expect from you as well. I feel that it is anyways important to invest 4 or 5 years of your life in learning more skills and learning more things, and that way UK offers some stability in terms of not moving around places. Excellent hands-on experience, no doubt about it. Anybody who's trained and worked in the UK can vouch for this. No matter where you're working in the NHS, there is ample hands-on work, which I feel is a very important and often less talked about part of fellowships. You're paid quite well, so you can even save, a certain amount, so that if you're planning to come back, you have a buffer when you start off your practice. There is a good work-life balance whilst you're there. Weekends are free. You can move around in Europe. All countries are pretty much within a 2 hours traveling distance. It's a good option if your spouse is also medico, because again, NHS being a public system, lots of opportunities for all specialties. And there is always an option of settling in the UK. So that's about it.